Hello friends, welcome to UGC EPG Pathshala. I am Dr. Gargi Kaur Majumdar from Shahid Bhagat Singh Evening College, Delhi University. Today I am going to talk about prevention and management of heat waves. Let's first understand the learning objective of this module. That is to understand the phenomena of heat wave first, then to understand the impact of heat wave on human health and understand the vulnerability of India to heat wave, and also to understand how to acquaint with the preventive measures of heat waves. Let's understand the phenomena of heat wave first. Unlike other massively destructive hazards such as floods or tropical cyclone, the heat wave is considered slow onset hazard or creeping hazard that sometimes gains more catastrophic than for aforementioned hazards. Generally, people play down the risk of heat waves as discomfort rather than as a hazard that could be detrimental to health. Heat wave gained focus as a major hazard due to heat wave events in Europe last decade. In 2003, Western Europe observed high level of mercury at some places above 38 degrees centigrade, which deviated about 8 to 10 degrees centigrade above normal. This resulted in more than 35,000 deaths across the Europe. France was amongst the worst affected with 14,800 casualties. When we compare European countries like in the temperate zone with India, which has a dominant tropical climate, we observe that temperatures such as 38 degrees centigrade may be considered normal by Indian people as contrast to Europeans, as Indians are acclimatized to high temperature. Whereas in Europe, where average temperature is low and stable for most part of the year, a moderate deviation from normal results in public emergency. Although this does not mean that deviation from normal temperature does not pose risk in India, it poses immense risk to people. It comes down to risk perception of the people in that they do not see increased temperature as a concern to health, but merely a natural phenomenon. In India, the typical phenomena of heat wave was observed in 1998 and latest in 2015. In the year 2015, heat wave caused death of at least 2,500 people in multiple regions. South Indian states of Andhra Pradesh and Telangana were the most affected due to heat waves. The number of casualties were 1,735 and 585 respectively for both states. Other casualties were also reported from the state of West Bengal and Orissa. Heat wave leading to extensive casualties calls for effective prevention and management for the hazard. Let's first understand the criteria for heat wave in India. Heat wave is marked by the period of abnormally high temperatures more than the normal maximum temperature that occurs during the pre-monsoon, that is between March to June summer season. Indian Meteorological Department, which is IMD, came up with the following criteria to define heat wave. Heat wave need to be considered till maximum temperature of a nation reaches at least 40 degrees centigrade for plains and at least 30 degrees centigrade for hilly regions. When normal maximum temperature of a station is less than or equal to 40 degrees centigrade, second criteria being heat wave departure from normal is 5 degrees centigrade to 6 degrees centigrade. Then severe heat wave departure from normal is 7 degrees centigrade or more. Also, when normal maximum temperature of a station is more than 40 degrees centigrade. Heat wave departure from normal is 4 degrees centigrade to 5 degrees centigrade, and severe heat wave departure from normal is 6 degrees centigrade or more. When actual maximum temperature remains 45 degrees centigrade or more, irrespective of normal maximum temperature, heat wave should be declared. World Meteorological Organization defines heat wave as the phenomena of 5 or more consecutive days during which the daily maximum temperature exceeds the average maximum temperature by 5 degrees Celsius. Now, let's understand the impact of heat waves on human health. Human body tries to regulate core temperature within healthy limits, which is about 37 degrees centigrade, through a process termed homeostasis. With mild exercise, the temperature of body increases to about 38 to 39 degrees centigrade without any harm to health until the thermoregulatory system is within its control range. Staying within the control range requires the body to balance heat production by the body and possible other heat gains. For example, solar radiation, with the resultant heat loss. The heat loss is primarily by regulating body temperature through sweat production and regulating blood flow. During heat waves, proper functioning of both systems is essential for thermal regulation. If they are immensely stressed and cannot match the thermoregulatory demand, this leads to excessive strain on the body and eventually may cause heat illness. Heat syncope, heat exertion and heat strokes are some of the heat-related illness. Heat syncope is related to heat exposure that produces orthostatic hypotension. This hypotension can precipitate a near syncopial episode. Heat syncope is believed to have resulted from intense sweating, which leads to dehydration followed by peripheral vasodilatation and reduced venous blood return in the face of decreased vasomotor control. Heat exhaustion is marked by excessive dehydration and electrolyte depletion. Symptoms may include diarrhea, headache, nausea and vomiting, dizziness, tachycardia, malaise and myalgia. Heat cramps are painful, often severe, involuntary spasms of the large muscle groups used in strenuous exercise. Heat cramps tend to occur after intense exertion. They usually develop in people performing heavy exercise while sweating profusely and replenishing fluid loss with non-electrolyte containing water. When body temperature increases up to 40 degrees centigrade or more, it results in heat stroke. It is characterized by delirium, seizures and coma. This is potential fatal condition. The above mentioned conditions are direct effect of heat wave on human body, but there are likely different mechanisms through which a person may die during a heat wave due to environmental temperature combined with extra strain on cardiovascular system. It is characterized by dehydration, display of increased blood viscosity and physiological changes. In theory, any illness that compromises thermoregulation will increase the risk of heat-related deaths. If exposure of heat wave is severe enough, even healthy person may fall for heat stroke. Figure 1 shows the symptoms of heat-related illness. Vulnerability of heat wave in Indian context. Let's first discuss that. Vulnerability to heat wave is highly dependent on the health status of the individual. Besides that, other determining factors of heat wave hazard vulnerability are the socio-economic and environmental characteristics that include the age, gender, income, marginalization and social isolation, thereby reduction in the access to remedial measures and information, vegetation and health characteristics, etc. Vulnerability map of heat waves shows that 10 districts in India are having very high vulnerability for heat wave. Most of these districts are in central India, Madhya Pradesh and Chhattisgarh. The most vulnerable districts are Dakshin Bastar, Dantewada, Bijapur, Chhattisgarh, Pakur, Jharkhand, Alirajpur, Shiopur, Barwani, Jhabua in Madhya Pradesh, Malkangiri in Orissa, Banswara in Rajasthan and Dohad in Gujarat. The low vulnerable districts are along the western side of the Western Ghats. 97 districts in India fall under the high vulnerability to heat wave and 213 districts fall in higher than normal vulnerability to heat wave. Thus, a high vulnerability to heat wave hazard necessitates us to take appropriate measures in terms of its measurement and prevention. Now, let's understand how management of heat waves can be done. First, preparation of action plan, that is, preparing an action plan is an ideal way to tackle the heat wave. Given the administrative setup of the country and socio-economic variability, this action plan should be developed at the level of local self-government, that is, municipal corporations or Jilla Parishads. Ahmedabad Municipal Corporation in the state of Gujarat was first to come up with such action plan in 2013 and it has been updating the plan on regular basis. The major focus of the action plan is on developing an early warning system, characterizing well-structured organizational responsibilities, developing healthcare services to cater to heat-related illness, and promoting adaptive measures. Other than Ahmedabad, 17 cities developed their own specific action plans containing public education, warning for high temperature, and suggestions to tackle excessive heat. These cities include Nagpur, Gondia, Chandrapur, Akola and Jalgaon in Maharashtra and Bhubaneswar, Puri, Koraput and Baleshwar in Orissa. Second is developing early warning system. An end-to-end early warning system is very helpful to minimize the risk of heat wave related illnesses. This can be done by issuing advisory to people through local news channel, newspaper, radio, etc. Ahmedabad Heat Action Plan devised color signals for heat alert, which is given in figure 3. From last year, Indian Meteorological Department began issuing heatwave bulletins. These were transferred into local alerts by municipal authorities to issue early warning to citizens. Then another step is public awareness and community outreach. To increase the preparedness of communities, constant public awareness campaign is necessary. This can be implemented through spreading messages such as how to protect against heat wave by means of print, electronic and social media. Running commercials on electronic media, radio regarding do's and don'ts for heat waves. Odisha initiated awareness campaign for heat wave in vulnerable districts from 2002 to 2008 under the Disaster Risk Management Program. The awareness campaign was implemented in collaboration with United Nations Development Program UNDP, wherein volunteers from the communities were trained to disseminate information regarding do's and don'ts at the grassroots level. Through media broadcasts, heat wave advertising campaigns were held. The major focus of disaster risk management was on to what to do in order to avoid heat stroke, symptoms of heat attack and first aid information. The media used for this campaign were both electronic and print media, including posters and pamphlets. These campaigns helped in reducing the mortality due to heat wave over the years. Transfer of information and reach of the awareness program dependent on the literacy levels, diffusion of technology such as television and radio in the concerned areas. To reduce the exposure of heat waves, the working hours, timings of schools and buses were changed. Adequate supply of water and electricity was also ensured. Fourth step is participation of NGOs and civil society. With the participation of non-governmental organizations and civil society to improve access to water, development and strengthening of temporary shelters and bus stands and developing means to tackle heat wave conditions. Now let's discuss prevention of heat wave. To prevent heat wave, there is a need to consider this phenomena as a risk to health rather than considering it merely a natural phenomenon. Some simple steps of do's and don'ts should be followed at the individual level to tackle heat wave, such as avoid going out in the sun especially between 12 noon and 3 p.m. Drink sufficient water and as often as possible even if not thirsty. Wear lightweight, light-colored, loose and porous cotton clothes. Use protective goggles, umbrella or hat, shoes or slippers while going out in the sun. Avoid strenuous activities when the outside temperature is high. Avoid working outside between 12 noon and 3 p.m. While traveling, carry water with you. Avoid alcohol, tea, coffee and carbonated soft drinks which dehydrates the body. Avoid high protein food and do not eat stale food. If you work outside, use a hat or an umbrella and also use a damp cloth on your head, neck, face and limbs. Do not leave children or pets in the parked vehicles. If you feel faint or ill, see a doctor immediately. Use ORS, homemade drinks like lassi, torani or rice water, lemon water, buttermilk, etc., which helps to rehydrate the body. Keep animals in shade and give them plenty of water to drink. Keep your home cool. Use curtains, shutters or sunset even and open windows at night. Use fans, damp clothing and take bath in cold water frequently. Now let's discuss urban heat island effect. Urban heat island UHI refers to surface and atmospheric modification due to urbanization, generally leading to modified thermal climate that is warmer than the surrounding non-urbanized areas. Higher urban heat is a result of heat released from anthropogenic activities including exhaust from vehicles, power plants, air conditioners and other heat sources, and also in the form of solar radiation. All anthropogenic heat enters into environment directly. Part of the solar radiation heat the environment directly, the rest is absorbed by the complex urban built structure and hit the environment indirectly. The increased temperature in urban localities lead to the urban heat island effect that may affect the number of hot days. It is also known to increase the duration of heat waves, thereby increasing the potential risk of mortality from heat stress. There exists correlation between UHI and heat wave observed through various academic research. It has also been observed that mortality is more sensitive to heat in urban areas compared with rural and suburban areas. The adverse effect on human health due to increased exposure of extreme thermal conditions due to the UHI enhances the intensity of heat waves. Urban heat island contributes exacerbating the effects of heat wave. However, the degree of UHI varies from place to place due to the level of urbanization, land use, land cover, vegetation cover, etc. The incorporation of proper town planning measures including greenery and water resource management reduces the catastrophic effects of urban heat island phenomena. Now, I am going to discuss with you a case study of European heat wave of 2003. Heat wave in 2003 in some of the European countries was unprecedented and massive, but heat wave had also been observed in Europe before 2003. There was an episode of heat wave in France in 1983 which killed more than 300 people. Athens, Greece observed severe heat wave in 1987 resulted in death of 2000 people. Other countries such as UK in 1976 and 1995, then in Portugal in 1981, Netherlands 1994 have also experienced heat waves before 2003. Yet the heat wave of 2003 was different. This heat wave was result of high temperature anomaly and associated drought and dry weather. The temperature anomaly was amplified by severe soil moisture deficit originated in the previous months as a consequence of the below average precipitation in earlier winter and spring. The result of heat wave was cascading and far-reaching. It resulted in higher mortality, forest fires, restricted electricity and big economic losses. The mentioned figure 5 describes number of deaths associated with European heat wave in different countries with threshold of normal temperature and deviation from the threshold. The impact of 2003 heat wave was particularly devastating for France. In the August 2003, mortality increased by 60% compared to average values observed for the same interval of 1999 to 2002 period. The increase was mostly observed in most of the vulnerable population, that is elderly and women. 70% increase in mortality was of elderly as compared to reference period between 1946 to 2002. Women mortality showed about 80% increase among women, that is somewhere around 9,510 compared to men, which was 5,292. The pattern can be observed in the other countries, although number of deaths varied due to their pre-existing vulnerabilities. Other than age and gender, social class status of the victim was another important factor. Lower social class groups were considered more vulnerable. The social class status was also corroborated to less air conditioning and having few rooms. The heat wave contributed to large amount of total burnt area, that is somewhere around 7,39,000 hectares in the 5 European countries, namely Greece, Italy, France, Portugal and Spain. In Portugal, forest fire concentrated in the central region of the country and resulted in massive total burnt area. This area burnt between 1st and 7th August and roughly 2 lakh hectare, and estimates for total burnt areas for the end season was 4,31,000. This represents roughly 5% of the Portuguese territory. Impact on the agriculture was profound too. Italy, Germany, Austria, Spain, France and Portugal had a poor agriculture season. This was due to the combined effect of the drought and the excessive temperatures since June 2003. This resulted in the increased production cost and increased risk for harvest, productivity and markets. Fodder sector, livestock, that is poultry and eggs production was affected. Fodder was deficit varied from 30%, that was for Germany, Austria and Spain, to 40% in Italy and 60% in France. Almost 4 million broilers died in France due to heat wave, and the poultry flock was reduced by about 15% to 20% in Spain. Potato production in the European Union was decreased by around 5%, with Germany minus 25% and Spain minus 30% had the highest reduction. The heat wave also had an impact of heat wave on the power sector, mainly on the prices and hydroelectricity plants. Electricity prices increased about 100 euros megawatt. The flow of the Central European rivers reached all-time low levels in August and September 2003. Due to the reduced flow, hydroelectricity plants were forced to reduce their production of electricity because they were unable to divert enough cooling water from the rivers. German nuclear facility ISAR-1 reduced its power generation by about 40%. Many French nuclear power plants suffered from overheating, which led to interruptions of power. A case study of European heat wave of 2003 shows that the heat wave has the potential to be catastrophic. Heat wave impacts not only in terms of mortality but had detrimental effect on key drivers of economy such as agriculture, electricity generation. There is a need of improving the quality of facilities and disaster management capacities of respondents, both officials and volunteers. Identification and capacity building of vulnerable people is also a necessary step to address heat wave risk. At the time of heat wave of 2003, only 2 cities in Europe, that is Rome and Lisbon, provided heat wave alert system. In 2010, many European cities developed extreme temperature prevention plans and alert plans, which was get activated once weather forecasts indicate safety threshold set for the specific locality or town being exceeded. Europe analyzed the negative consequences of 2003 heat wave, learned from the past failures, invested in capacity building measures to develop greater resilience to heat wave. A robust weather monitoring heat wave advisory network information dissemination network along with the building up of heat wave management capacities in the respondents would bring about increased adaptive capacity to face the risk of heat waves in India. Heat wave response in India, let's understand that today. Heat wave has an effect on almost all the level of people in the affected areas, but the severity of impact and the response required for the severity varies. A large number of people would be facing minor discomforts and mild symptoms which could be effectively catered to by ensuring appropriate awareness about heat wave phenomena, and thereby self-care would suffice. A significantly lesser number of people would be more severely impacted, and effects such as cramps, heat exhaustion or heat syncope would require medical aid from physician either personally or through telephonic media or a visit to a clinic and mild medication. A far lesser number of people would suffer from heat stroke, thereby requiring the services of ambulances and admit to emergency rooms and intensive care from expert doctors. Ever less number of people would succumb to severe effects of heat stroke. The heat wave of 2015 in the states of Andhra Pradesh, Telangana and Karnataka led to offices, schools and colleges shutting down during peak heat hours. Schools were instructed to advise children to return to their home before 1 o'clock in the afternoon. MGNREGA work has halted during the peak heat hours. In Ahmedabad, construction projects were asked to give their workers a 2-hour break. Public parks were kept open the entire day to enable people to rest. Free and adequate drinking water at public places was ensured by government. ORS, which is oral rehydration solutions, were distributed freely. Social media platforms were used to spread awareness and to communicate advisories. Thus, we observed that proper measure in awareness generation and self-care would lead to a significant reduction in requirement for specific and expert response. Now, let's do a probing of heat wave management. Heat wave emerged as a major hazard in last few years. The impact of heat wave on humans, economy, livestock and environment has necessitated the seriousness of preparedness, mitigation and response to heat waves similar to fast onset damaging events like cyclones or other major hazards. Heat wave affects day-to-day life of people. The European heat wave of 2003 showed the necessity for preparedness to heat wave to build disaster management capabilities with respect to public health, monitoring and forecasting of heat wave and a sound early warning system. The objective of the alert system must be to set up strengthened action and prevention measures based on sound advice for vulnerable population. Risk perception to advisories on heat waves could not be considered serious due to above 30 degrees centigrade being moderately frequent in most states across our nation. Advisories are generally also disregarded due to the socio-economic condition that necessitates everyday labor in order to receive wages in a hand-to-mouth existence. The consideration of vulnerability parameters and the corresponding measures to reduce vulnerabilities and building capacity for response and risk reduction are extremely important. Changing demographic trend and an aging population add to the risk of heat wave. People working in quarries, farms, daily wage laborers are more vulnerable and at more risk of heat wave in India. Simple preventive steps needed to be taken to mitigate the impact of heat wave. Heat wave cannot be controlled in terms of severity or appearance or duration, but it is manageable and preventable following some simple solutions as described above. A targeted awareness campaign with inclusion of temperature alerts and instructions to avoid heat can significantly bring down death toll. Notion of heat wave merely as natural event whose effects are inevitable need to change. As European heat wave of 2003 displayed range of vulnerabilities in the European society and deficiency in response system. Preparedness, continuous monitoring and timely early morning will definitely help in reducing the detrimental effect of the heat wave on not only human society but also on whole ecosystem. The changing demographics, increased urbanization, changing socio-economic conditions and the increased frequency of high magnitude, high intensity hazard events require the need to focus on planning, housing and social integration. Now let's summarize whatever we have covered in this module. World Meteorological Organization defines heat wave as 5 or more consecutive days during which the daily maximum temperature exceeds the average maximum temperature by 5 degrees Celsius. Heat waves are marked by period of abnormally high temperatures more than normal maximum temperature that occurs during the pre-monsoon, that is between March to June summer season. Heat syncope, heat exhaustion and heat stroke are heat-related illness characterized by dehydration, display of increased blood viscosity and other physiological changes. Urban heat island contributes to exacerbating the effects of heat wave. Heat wave has an effect on almost all people in the affected areas, but the severity of impact and the response required for the severity varies. Proper measure in awareness generation and self-care would lead to a significant reduction in the requirement for specific and expert response. A targeted awareness campaign with inclusion of temperature alerts and instructions to avoid heat can significantly bring down death toll. Notion of heat wave merely as natural event whose effects are inevitable need to change. Thank you, friends.